I'm Alexis, the owner of Beauty Retreat. I'm a plastic surgery post-op concierge specialist. You can reach out to me and my team for any of your post-op needs. We'd love to be a resource for information, planning, and post-op care. And today we're here with Dr. Mendez.
Hi guys, my name is Dr. Mendez. I'm a double board certified plastic surgeon practicing in the Hinsdale area. I focus on breast and tummy surgery. Looking forward to this conversation.
Today we're going to talk about breasts and some of his specific post-op instructions because each surgeon, it varies how they want you to take care of yourself after surgery.
When I see a patient initially for a consultation for breast augmentation, I like to first understand their goals and the amount of fullness they want to achieve. So I always want to achieve something that's going to look very natural and proportionate to their body. So we have to take a lot of different factors in mind, including their measurements, their height, their weight, and also the amount of fullness that they want. Some patients want to be really conservative, some want to be on the more full augmented side. And then when I examine the patient, I determine if they are just a straightforward breast augmentation alone candidate, or if they are breast augmentation with a breast lift. And usually that's in patients that have had children or weight loss. They have some changes to their breast where they're sitting a little bit lower, or the tissue is sagging. So what a breast lift is going to do is going to bring the tissue up to that more central youthful position. So that's usually how I determine, which patient is a candidate for which surgery.
What are the differences with the aftercare for the different procedures?
So with a breast augmentation alone is definitely going to be a more straightforward recovery in regards to the wound care. So with the breast augmentation, it's a very small incision that's in the fold of the breast. It's about 1 inch long, and I cover it with a steri strip. So as a result, there's actually no wound care. The steri strip stays on for about a month, and after it falls off, then we start a scar cream called silicone gel. But with a breast lift, because the incisions are typically a lollipop or an anchor incision, those are longer incisions, and I like to keep those nice and hydrated by using either Vaseline or Aquaphor. So I have the patients change the bandages twice a day with Aquaphor or Vaseline and gauze, and then use a bra to keep everything in place. I like to avoid all adhesives and tapes just because I've found that some patients can have rashes or skin breakdowns, skin tears, blisters from those. So I like to just keep things, what's worked best for me and what's the most smooth and straightforward are those. Some patients ask about antibiotic ointments, and there can be some skin sensitivities to those. So things like bacitracin or Neosporin, the studies show they're not necessary. And I've had a few patients that when I initially started, when I was using bacitracin, they had some really terrible rashes and reactions. So I've just moved to straightforward Vaseline and Aquaphor.
As far as the procedures where you have the steri tape, just so we're clear on the showering instructions, you should be taking soapy, sudsy water and just kind of letting the water fall, not necessarily scrubbing or irritating the incision.
Yeah, for the steri strip, I put skin glue as well, so that is waterproof. You'll be able to shower for from day one, and for that first 3 to 4 weeks, it'll stay on. But yeah, just let soap and water run right on top of the incision. Same with the breast lift incisions. Once you take the bandages off, just let soap and water run right on top. You can dab gently, but I don't like to scrub the incisions while they're healing in those first 3 to 4 weeks. Afterwards, for both patients, they're going to be wearing a supportive compression bra that we provide for them. It's basically like a high-grade sports bra that clips in the front, and they're going to be wearing that 24/7 for the first 4 to 6 weeks to help minimize swelling and keep everything in good position.
Kind of piggyback off of the compression garment for the breast. Some surgeons use an additional compression to kind of press the breast down or help them drop faster. Can I get your take on that?
Yeah, I've seen that. Some patients ask about it. I personally don't think it makes a difference. I don't use that on my patients. I think a lot of what we do in plastic surgery is kind of how we trained, and there's a lot of dogma that they've done in the past that's worked for them, so they continue doing it. But there's no evidence-based studies that show that a band is going to help an implant settle faster. So I typically just let gravity work on its own and just use a regular compression bra, but no massages, no bands. I think, I try to keep things as simple and straightforward as possible after surgery, so I just don't think it's necessary. But I'm not saying it's wrong if other surgeons like to use it and it works well for them, then,
I know you mentioned the massages. Do you have them do the stretches where they're pushing their boobs together, or doing any stretches?
I just have them practice their normal range of motion. I tell them for the first 3 days with an implant in place, you're going to be, especially if you put it under the muscle, you're going to feel a lot of tightness once you raise up your arms. But I encourage them to, by the end of the first week, they should be able to go completely upright, be able to wash their hair. I don't think it's necessary. Some people have dinosaur or T-Rex arms for the first few weeks where they can't lift their arms up. And I just think it doesn't make a difference. And for my results, I'm happy with them. Moving very early, it doesn't affect the results, in my opinion. So I like them to get back to their normal activities within the first week and feel like they're back to their normal selves, and arm mobility is what is going to allow for that. So I don't have them do any specific massages. If they want to do lymphatic massage with a professional to help minimize the swelling, then that's great. But other than that, I just have them practice their normal range of motion, listen to their body, on when they feel like they might be doing too much. The other thing is, like, restriction wise, I don't like them to do any heavy lifting greater than 10 pounds or any chest exercises for 4 to 6 weeks after surgery, because I want that implant to stay in perfect position before they start activating the muscle. So especially as I place implants in both pockets depending on the patient's preference and their anatomy. So, but if the implant is under the muscle, we definitely don't want to activate that muscle for 6 weeks afterwards. So I have them do no upper body, but they can, especially in patients that are really active and like this exercise, they say they could start lower body stuff around the 2 to 3 week mark.
Oh, okay. Good to know.
Yeah.
Actually didn't know that part.
Very light, but yeah, just so they don't go stir crazy.
Okay, because that is a common question that I get, especially people who are very active. They're like, well, when can I take like a brisk walk or like do something that I feel like I'm actually exercising?
Yeah, walking from day one, I tell them to go outside, get a nice walk in 3 times a day, but like for it to be a brisk walk, probably around 2-3 weeks.
Okay, so even if they're doing breasts, are you a big fan of like compression socks for any procedure?
Yeah, I mean, breast procedures have a lower incidence of venous thromboembolism or DVTs, PEs, but definitely for surgeries like tummy tucks, body lifts, thigh lifts, arm lifts, those are higher incidences. Or if you're doing a combo case where you're doing a tummy and a breast, those have higher incidences of blood clots with cosmetic surgery. So, but even if you're doing a breast alone, I recommend doing compression socks for the first 2 to 4 weeks until they're really up and moving a lot, just to help minimize that risk as much as possible. Have them use those compression socks, walk 3 times a day. That's what's going to help prevent blood clots.
Can I please get your opinion on arnica?
Yeah, so arnica can be used post-operatively either topically, like a lotion or cream, or pills, orally. Any facial procedures I do, such as eyelid surgery, I have all my patients take the arnica pills post-operatively because it can help minimize bruising. Especially around the eyes, you can get a lot of bruising. It looks like 2 black eyes, so I want to try to prevent that and get ahead of it as much as possible, in addition to ice packs. With breast surgery, honestly, there's really not much bruising. It's more swelling. So if patients are interested in trying to do everything possible to minimize bruising and some swelling, they can take arnica pills after surgery. Same with the tummy surgeries. But topically, it's the same thing. I think you could do either or, and it can be helpful. But for my opinion, most effective when you're doing facial surgeries.
Your instructions correctly, I'm trying to think of it as it relates to breast specifically. You're also having them drink Juven as
Yes.
well.
So the most important thing for post-op wound healing is to be on a high protein diet, in addition to protein shakes. So I just tell patients to find a flavor they like, find a brand they like, take 1 or 2 protein shakes per day, starting 2 weeks before surgery until 4 weeks after surgery. And so that's going to give them the protein supplementation that they need. And then in addition to that, I have them take Juven, which is an Ensure shake that is for wound healing. So it's not a protein shake. It just has some nutrients and vitamins and collagen that are going to really help boost wound healing. And same, you take it usually 1 week before and 2 weeks after. I want to try to do everything I can to have patients heal up quickly after surgery and minimize complications such as any type of wound breakdown. So patients are usually on board with the same sort of thing. So those are the 2 things that I have patients do, is the high protein diet and the Juven shakes.
Well, I tell every patient, doesn't matter what procedure, like lower the amount of sodium that you're having. Because I know it helps with it makes you so bloated or so swollen. I mean, are there any other reasons why they should avoid MSG or getting some fried rice or something?
You have patients on a low sodium diet, high protein diet, low fatty foods, lots of fruits and vegetables, because these are just going to give you the clean protein and nutrients and vitamins that are going to help you to feel well, but also heal up well. Yeah, but a lot of sodium can cause you to hang on to swelling longer. It can really affect your initial result and comfort level.
What is your take on oxygen?
So hyperbaric oxygen can be used post-operatively, potentially to help enhance healing. In a healthy patient, I don't think it makes much of a difference. If someone has the device or has access to it, I think it's fine. I don't think there's any drawbacks to it. The really only drawback is cost. So if someone has access to it, I think it's fine to use. I think it's safe. But in our evidence, really the only areas that hyperbaric oxygen has been found to be beneficial is in burn victims who have very significant injuries and need whatever assistance they can to rebuild that tissue and skin.
So let us know, comment below if you have any questions or any way that we can help you in the future. So Dr. Mendez, how can people reach you if they're interested in a consultation?
So they can search my name on Google, Dr. Dino Mendez, or on Instagram, my handle is Dr. Dino Mendez. So take a look and let us know if you have any questions.
Comment any questions that you guys would like to know further information about.
Awesome.
Thank you so much.
Nice work.